Nothing matters more in the battle against the coronavirus than the hunt for a vaccine. This hunt is now the world's mission. And right here in India, that battle is being led by India's Serum Institute, one of the world's largest producers of a vaccine. We're joined now on the program by Adar Poonawalla. Adar, welcome. It's a pleasure talking to you. And I know that what I'm going to ask you is something that every Indian wants to know the answer to. Here's what we know. We know the Serum Institute, in partnership with both an American company and a French company, is on literally a manhunt to look for a COVID vaccine. Where does this research stand at this moment?
Okay, so Barkha, whilst we're all very desperate to find a cure and a vaccine, we must manage everyone's expectations. Typically, a vaccine takes 6 to 7 years to develop. We're shrinking that time down to 2 years because of regulatory help and collaboration, which I must say is excellent at the moment between the US, India, and all parties concerned. But having said that, to prove a safe and efficacious vaccine in less than 2 years will be a bit of a stretch, whether it's from us or anyone else. Having said that, we have to concentrate on proper trials and efficacy and safety studies being done before we can just take the first vaccine that just comes out of any lab. Because I know we're all desperate and we all want a cure and a solution soon.
Yeah. So explain to me, from what I'm reading, I understand that you're at the preclinical trial phase, which basically means that we're testing right now on animals. Can you elaborate a little bit on where this stands at the moment?
Okay, sure. So we're already in the United States, got a candidate which is in mice and primates as we speak. The animal data should be available in a month and a half to 2 months maximum, after which we will have to decide which country, either India or some other places, including China, to start a trial into humans. Being a new virus and the way it reacts, and we're all still learning everything about it, we don't know what kind of trial and how big that trial would have to be to prove efficacy. So that's the challenge at the moment. But I think in about a year from now, if the candidate vaccine works, we should be able to be licensed.
I mean, that is obviously fantastic news, but in the here and the now, what you're struggling with is what the world is struggling with. Like even when Donald Trump does his White House press conferences, you have the FDA stand up and say, look, it takes these many months to put a vaccine out. What is the quickest realistic time frame? And I know you've called for speeding up regulatory clearances. Is there anything in specific that could make this faster and easier for your team of researchers?
Okay, so I think what we all need to come to grips with is that this virus is here to stay. I think we're more likely to die of bankruptcy and riots and crime if we tread on livelihoods beyond what we absolutely need to. So it's all about mitigation at the moment. Not finding just a cure or whatever. Even if we do get a cure or a vaccine, please understand that it's not going to be 100%. People are still going to get infected. And once we come to terms with that, it's only about mitigating by reducing social and other gatherings and functions wherever we can. But when it comes to livelihoods, we have to keep businesses going. We have to keep the livelihoods going. And we have to come to terms with the fact that this virus is here to stay on this planet, and there will be many other viruses coming about also due to climate change and many other factors in the future. So we need to balance this in the responsible way, because how long are we going to be sitting at home, not going to work? People are losing their jobs, some permanently, some temporarily. So we need to address this.
So that's such an important point. And, initially, British Prime Minister Boris Johnson and his scientific advisors tried to approach the virus with what they called herd immunity. And their basic argument was that this virus isn't going to go away, so people are going to have to gradually build up immunity to it. And the reason that there's still need for social distancing is because you need to give your health system breathing space to cope with the number of patients. So Adar, what is that middle ground between not shutting down the country, not shutting down the world, not shutting down livelihoods totally, but still keeping ourselves safe? And in that light, what can a vaccine do, or what should a vaccine ideally be able to do?
I think, look, a vaccine is obviously the most cost-effective and best intervention if you have it, and especially if it's more than 70% efficacious. We don't even know the vaccines that will come out, will they be more than 60, 70% effective, meaning, 3 out of 10 people will still get the disease if they're vaccinated, if it's not a very powerful vaccine. We've seen traditionally other vaccines that have been there for pneumonia, rotavirus, measles, rubella, they all have different levels of protection. But having said that, we need to do mitigation. We need to improve our immunity, be healthy, but beyond that, and take precautions. But beyond that, there is very little one can do, and we have to go about living our lives. Otherwise, we're going to go back to the Stone Age. If you say that you can't come to work, what's next? Power companies, telecom companies will shut down. Are we going to be living in tents in the jungle? What is the plan in 2 months, 3 months time? Maybe we can survive like this for the next 2-3 months. But the leaders in our country and across the globe have to address this issue that if you don't have a cure, if you don't have a vaccine coming out in the next 3 months, what are we going to do? My answer to that is risk mitigation. You can only mitigate, you can't completely have a level of 0 and 100% protection or measures that you can take which will be 100%. I think we need to come to grips with that and deal with it together, which we're doing. The Indian government has rallied and done a great job so far, but now we need to think about the next step, including having more places to test the virus, which Kiran, I know, has been speaking a lot about, and that's essential as well, so that we all know if we're showing symptoms, we need to quarantine ourselves, and having more facilities to quarantine and test, I think would also be a great measure to scale up.
Yeah. In fact, Kiran was on this show calling for both greater ramping up testing and also getting the private sector involved, but we've not been able to settle that debate thus far. Government facilities continue to be the ones testing. Do you want to come in on that? I mean, how critical is it for the private sector to come in? And this whole debate, this appeal from the ICMR, the Indian Council for Medical Research, saying, look, private practice can test, but do it for free. Is that realistic? And if not, why not? Isn't this a moment for the private sector to also rally behind the larger national mission?
I think, as Modi ji said, if we can be sensitive to our employees, offer free testing to the public, do whatever we can. Yes, the private sector, at least for a temporary period of 2 to 3 months, can look at doing things for free. But I think we need to collaborate, and I don't know the specifics about how far the testing centers have come about to become private as well. But I think there's only so much the government can do. And if we want more centers for quarantining and also places to have people quarantined and also private testing centers, the government will have to allow and train the private sector to be able to do that so that we have enough testing labs and rapid testing labs and quarantine areas.
I want to pick up on something you said. You said even when there is a vaccine, there is no 100% guarantee that someone won't get the COVID-19, right? And I get that because it's like taking the flu vaccine and some people will still get the flu. It's like any other vaccine. But the point is, what about an attitudinal change to vaccines? Most people don't take vaccines. Most people do not take preventive vaccines in this country, at least for some diseases. Do you think this is that inflection point where the debate over vaccines at least is going to end once and for all?
Yes, I'm so glad you brought that up because, adults traditionally don't take vaccines. That's why our H1N1 vaccine, when we made it, 5 years ago, 4 years ago, nobody wanted to take it. Vaccines generally are taken for children, and that's when, mothers make sure that the children get vaccinated. I hope that one thing that comes out of this whole panic is that people take vaccination seriously, even the adults, because as you mentioned earlier, the scientific experts have always said that there is a certain level of herd immunity you can get if you vaccinate, beyond 80-90% of our population against a particular disease. Yeah. So that will act as a major barrier and go a long way to preventing the disease from penetrating a particular area or a country or a state. Okay. So I hope they take that more seriously now. And you've seen certain diseases like measles coming back in the United States because adults stopped vaccinating themselves because they didn't see the disease, so they didn't feel the need to vaccinate. But even in DC, you heard Washington DC had cases of measles, a disease that has been virtually eradicated in most parts of the globe.
Yeah. One more thing, you're calling for mitigation by governments, a mitigation strategy that does not shut down, that does not cripple the world while trying to save it. And I totally get that. But, I was reading in the FT, in the Financial Times, the main highlights of the Imperial College study, which basically looks at 3 different scenarios. And it basically says that, even if you impose reasonable restrictions, you could still be looking at the fact that there isn't enough critical care capacity, even in richer, wealthier countries like the United States and Britain. And India, we know, has, I think, 2.3 critical care beds per 1 lakh people. So, Adar, what is that golden mean? What is that golden middle ground where you mitigate risk, but you don't shut down the country?
So, as we all have been discussing what is the right balance. I think the government and private sector need to sit together, form a core committee with representatives from every sector: food, pharmaceuticals, steel, auto, everywhere, IT, and come down to a figure of the minimum basic essential goods and services that are required to keep the country going. And based on that, come to some middle ground that, look, everything apart from this has to temporarily be suspended. Maybe in the future, a care package, a financial package like there is being probably going to be announced in the US, might come about in India at a later stage to put the people who have gone out of pocket back into some sort of sanity level, and that's the only way to mitigate. We need to find those core essential goods and services that we need to function as a country: power, telecom, pharmaceuticals, whatnot, and just reduce the numbers that way. Beyond that, what can we do? And look, there may be a point where we'll have to decide as a nation that what's the higher risk, what's the lesser evil. Do we let people get infected with COVID-19 at the cost of them, or is it a greater evil letting people just get bankrupt and resort to crime or suicide?
Yeah.
So that day is coming in the next 3-4 months. Yeah. And that's why I raised this point that we need to decide, the leaders need to decide now on finding the right balance. Otherwise, we're going to be in very serious trouble in 3 months' time.
Yeah, and these are terrible choices for any leaders to have to make. But those are, the choices that Italy, for example, is having to make today. And we hope that India does not reach that point. I do have 2 more questions for you. One, there's been some amount of excitement about chloroquine, which Indians have been traditionally taking for malaria, at least back in the day. Has your research team found any reason to believe that chloroquine, in combination with other retroviral or antiretroviral drugs, is therapeutic? At least that's the first question. So let me take that to you first. Do you have any news on the use of chloroquine or the efficacy of chloroquine?
I think the world today is hoping that this drug helps and works to protect and treat people with COVID-19. But I think if we really want to be sure, we need to do proper randomized, double-blinded, gold standard trials, where there's no bias, and really see if this drug, which has been around for 30, 40 years and is quite safe to use. At least that is established because it's been used to treat malaria and other things. We need to do a proper trial. That's my answer, to really know for sure. And that can be done over the next 2-3 months in countries where there are a lot of cases. Maybe these trials can be done in Italy and other places which are heavily affected. And then we'll know that answer. I think we can get to that answer in the next 2 months. But I think today, to come to any conclusion that any drug without a proper trial is working is just hopeful, wishful thinking on our part. And I think we should stay away and be very careful of such speculation, because we don't want to give false hope. We want to manage expectations in a proper way. And I think we're very close to it. And I really hope it works. We just need to do the right trials to prove that in the next 2 months. And that's very possible to prove.
Absolutely. A last question. What's the timeline if all regulatory hurdles were eased? And you seem to suggest that is not the main challenge right now. what is the timeline that you're looking at for the Serum Institute to be able to develop a vaccine with its partners? And what would help you at this point? What would help your team of researchers?
I think what would help is speedy regulatory approvals, but we are already told that that's already in place and that's moving well. So I must compliment the Health Ministry for moving very fast and having procedures where we've heard that we can import strains now without many other bureaucratic hurdles that used to be there, and we've acted fast on that. I think now we need to just give it some time to get the animal data out in 2 months, as I mentioned to you earlier. And then after that, I would be able to comment. I want to be very responsible at this stage in my predictions and comments, because I don't want to give any false statements or hope. And so I think in 2 months, if you ask me this question, I can give you a more accurate response, because by then we know also what kind of human trial we'll have to do, how long it'll be, how big it'll have to be, and in which country we want to do it in. So I think let's come back to that in 2 months, but I'm quite hopeful that in a year and a half, from this June, we should be able to launch a vaccine if it's proven to be efficacious and safe. So there are a lot of ifs and buts. That's why I don't want to make any comments beyond that at this stage. I think we can come back to that in 2 months and answer that in a very accurate and specific manner.
I totally understand. And at this moment, I think I can, on behalf of the country, only wish your team of researchers good luck. I think this is a global chase, the hunt for the COVID vaccine. Adar Poonawalla, it's been a pleasure talking to you.